It's a Northwest lifestyle weekend on KOMO News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our next guest, Heidi Rock, Emergency Management Program Manager at MultiCare Health System. She's a person who we just don't really want to have do her job because it's because of an emergency situation that she gets called into action. And, God forbid stuff like this happens. But she's there and people like her are there in case.
But we're sure glad she's there because coordinating hospitals and physicians in major events or small events, emergency preparedness is huge in today's world.
All right, let's talk to Heidi Rock and Shannon O'Kelly.
Heidi, thank you for joining us here on Health Talk. How are you doing?
I'm doing great, thank you.
Tell us about your role. You're the emergency management coordinator. Give us your title and what your role is.
Okay, so I am the emergency management program manager for MultiCare Health System. And in partnership with our business continuity program manager, we do disaster planning for the whole system. And so we help to facilitate training, new plans for what we like to call all hazards approach, but specifically, earthquake, severe weather, active shooter, things like that.
So you take care of any kind of emergency preparedness as it relates to anything, whether it's a natural disaster, earthquake, fire, and also these man-made disasters that unfortunately in the world we live in, we have to experience and be prepared for.
Exactly. We need to be prepared for anything that could come at us.
And what do you do? Can you give us an idea, kind of what's a day like in the life of Heidi Rock?
Well, it depends greatly on the kind of meetings we might have, but there's a lot of plan writing. We're in the process of updating a lot of our evacuation plans, different disaster plans. There's emergency management committee meetings at each hospital facility, and so I could be traveling around to the different hospitals being a part of that. We work very closely with Pierce County. I'm specifically a lot in Pierce County, so we work closely with the Pierce County Department of Emergency Management, the Tacoma Pierce County Health Department, the Northwest Healthcare Response Network, which is the Healthcare Coalition Emergency Preparedness Network for King, Pierce, and Kitsap counties.
Wow, I'm glad there's someone like you out there. I don't think the average person, we all grew up and probably attended some kind of organization that taught you how to be prepared or those kind of acronyms. Safety and the 10 essentials and the earthquake kit and all that stuff we should have in our homes.
Yes.
Here I am. I'm guilty. I think I have earthquake kit only because my wife's from San Francisco. But hey, what should we be doing? Really, what is our awareness as a homeowner, as a family, as a citizen? What do you want us to do?
They used to say 72-hour kits or 3 days, 3 ways. They have now realized that 96 hours is what you should prepare for. So you need to be able to sustain yourself and your family, and please don't forget your pets for 96 hours. Because any type of help, government help, they've got to have time to mobilize and get here. So you really need to be able to take care of yourself, and that includes water, food, medicine. Medicine is a huge one. If pet food, one thing I always tell people, especially for your meds like insulin, anything that is life dependent, you need to have a plan for that.
Let me ask you something, because as you're thinking here, I'm checking my box going, I got to get prepared. So thank you for giving me the incentive to do that. But I'm thinking to myself, so many people in today's world don't have home phones. They have cell phones, right? And in a disaster, can a cell phone service, I would imagine it's susceptible to going down. How do you communicate then?
So the one thing about a disaster is that cell phones are going to be jammed. So we recommend that you have an out-of-area contact. My family's out-of-area contact is in Florida, so hopefully they're not having a hurricane at the same time we're having a disaster. Everyone in the family will have that same emergency contact. So if you can't get a hold of each other, everybody makes that phone call to that out-of-area contact, and so they can say, yes, my daughter is safe and she's here and things like that. So that's how you communicate. Oftentimes you'll be able to send a text, but you won't be able to make a call.
You send a text, but won't be able to make a call, but is there resources? Are there places where your community, like in your role, do you develop communication centers so people can come and communicate to relatives if they need to?
What would happen in the event of something major would be a family reunification center. We don't have specific areas where people come to make calls.
Back with Heidi Rock and Shannon O'Kelly right after this timeout on KOMO.
It's a Northwest lifestyle weekend on KOMO News. Now back to IRG's Health Talk.
Our second segment now of our conversation with Heidi Rock, Emergency Management Program Manager, and Shannon O'Kelly.
Well, Heidi, thank you so much for joining us, and thank you so much for reminding me to get prepared, because I think everybody's human nature is, that only happens in other places in the world.
Right.
And here in the Puget Sound, we have several things, particularly earthquake and things like that could happen. But more importantly, just accidents. I mean, you probably experienced and had firsthand experience with the recent train wreck in Pierce, Thurston County.
Yes.
And how do you coordinate hospitals and get everybody on board, and where do patients go, and how do you decide what hospital takes them, and all that? That's got to be just like a chess game.
It is and it isn't. So we have a system put in place. And so I will give you an example of what would happen at that train wreck. Now, it was a little different because it was on the Thurston-Pierce County line. But the way that would work is the first arriving person on the scene, which is the incident commander, would call what's called the Disaster Medical Control or Coordination Center. And each county has one of those. Pierce County's is at Good Samaritan Hospital in Puyallup, and it's a county entity. So the incident commander calls in, they say they have a mass casualty incident, and they give an approximate number of patients. Now, we rate patients, or we triage them in the field by greens, yellows, and reds. Reds are very critical. Yellows are sick, but not critical, and greens are what we like to call walking wounded. So they will call the DMCC, let the DMCC know this is what they have. During that time, the DMCC will then call out to the different hospitals to figure out how many of each of those patients the hospital can take, reds, yellows, greens. And then the DMCC will work with the transport officer on the scene to get those patients transported to where they need to go. And it's very much based on what kind of patients the hospitals can take based on their trauma designation, based on their stroke designation, and things like that. So certain traumas would only ever go to Harborview because they are the only level 1 trauma center in our state. But we alternate trauma level 2 with St. Joe's and TG down in Pierce County. And so they are trauma every other day. And so much of the trauma down there can go to one of those hospitals. And then there's Madigan too.
Wow. I'm thinking to myself as you're talking, there is hundreds and hundreds of people involved in a disaster, or potentially could be involved in a disaster.
Oh, yeah.
You got to practice. I mean, how do you? I mean, you guys got to practice this stuff all the time. I mean, practice makes perfect, right?
Yep. Well, if we were perfect, then we'd never have anything to keep practicing.
Yeah, right.
But we do practice, and the Joint Commission, who accredits our hospitals, they actually have requirements along with the Centers for Medicaid and Medicare. So we are required. Each facility is required to do at least 2 drills a year. One that involves a surge of patient, like a mass influx of patient. The other one is one that involves community involvement. So we do drill every year, and then we have real world incidents that we practice with as well.
Wow. I mean, it's complicated, but I'm so thankful that there's people and like your organization, folks out there that are doing this, because, again, I say this is never going to happen to us, right? And that's what everybody thinks, but it does. As we wrap up here, give me one thing that everybody should do.
Build a kit. Get your kit at home and in your car if you can. This is the most important thing you can do, is have a plan.
Thank you, Heidi.
You bet.
Shannon, as we've seen in the news all too frequently recently, there are situations across our country and around our world where emergency management people like Heidi Rock get called into action, and they're invaluable when these situations, as frequently as they happen, come up.
Absolutely. And it makes me think of your home life. I mean, my wife is from San Francisco, so we have an earthquake kit, and it's a garbage can full of all those needs, and I'm glad she's organized.
All right, if you'd like to get more information on what Heidi does, multicare.org. We're back with our final segment right after this time out on KOMO.